Good afternoon, everybody. Dr. Michael Jacobs here at the Fertility and IVF Center. Welcome to our Monday afternoon Instagram chat. Today's topic is uterine assessment, what you need to know, and what's the difference between hysterosalpingogram, hysteroscopy, ultrasound, saline infusion, sonogram. What are the things that we do to assess your uterus from an anatomic standpoint we're talking about today, rather than from a functional standpoint. And obviously, to be successful, the uterus does need to be anatomically normal as well as functionally normal. The functional part we'll talk about another day, but it involves being able to respond to hormones appropriately so that the implantation bed in the endometrial lining where the embryo goes to implant, the sort of the Velcro in there is good enough for an embryo to stick. But one of the key questions that we always ask when a patient comes for infertility is the uterus normal? Is the anatomy okay? And to do that, we do a couple of different things. First and foremost is a good physical examination. And often on an exam, you can feel if the uterus is enlarged or not enlarged. In many patients, it's kind of difficult to feel the uterus exactly. And obviously, patients who are a little chunkier, a little more overweight, it becomes very difficult to really assess clinically on a normal gynecologic exam, is the uterus normal or not. So at your initial visit or very early on in your evaluation with us, we would normally do a pelvic transvaginal ultrasound. And a transvaginal ultrasound just lets us look at the uterus by ultrasound and assess whether there's anything grossly abnormal in the myometrial or endometrial layers. It tells us if the size is normal, if there's any fibroids there. It may tell us if there's a suggestion of what's called adenomyosis when the endometrial lining invades the muscle layer of the uterus. It also tells us whether the ovaries are in the correct position. It does not tell us anything about the fallopian tubes. And unless one is going to inject some kind of contrast material, it doesn't really tell us about the inside of the endometrial cavity. We sometimes will, if we're suspicious of a problem, like a uterine septum, doing three-dimensional transvaginal ultrasound is sometimes helpful to give us a better view of the cavity on the inside. What that's doing is just taking multiple images on the ultrasound and then sort of mix it. So it's sort of like taking a bunch of pieces of paper together and then reconfiguring them electronically with an algorithm to give you a three-dimensional appearance of the uterus. So the computer and the ultrasound machine will take multiple two-dimensional images and recreate a three-dimensional picture of what the uterus looks like. And that's another way of trying to see if there's something invading the endometrium. But in general, regular two-dimensional ultrasonography will tell us if there's a major lesion present. It gives us a good example of the myometrial wall, of uterine fibroids. It gives us some sense of the endometrial cavity, but is not really definitive enough to tell us that the endometrium itself is normal. The inside of the endometrium is very important because that's where the embryo implants, and anything that's on the inside of the cavity, whether it's scar tissue, endometrial polyps, endometrial submucous myoma, or fibroids that are in the wall of the uterus compressing the cavity, just distorting it, any of these things can affect fertility and may impact potential miscarriage. So what do we do to look at the inside of the cavity to assess if the inside of the cavity is normal? There are different things that are available. Our preferred method is called an office hysteroscopy. A hysteroscopy is using a small fiber optic instrument, and the diameter of the fiber optic instrument is about 3 millimeters, and using saline as a distending media in an office setting without any anesthesia other than perhaps taking some Motrin or Advil before coming to the office, we can guide under direct vision using a video system this very fine telescopic camera called a hysteroscope into the cervical canal and uterus and actually visualize what's in the cavity. It's our preferred method because we can see what we're looking at. We're not looking at, okay, there's a filling defect or some distortion, but we don't know what's causing it because you're not looking at it directly. In this case, we're physically looking at it's like driving your car inside the tunnel and looking at the inside of the tunnel, inside of the uterine cavity. A normal uterine shape is a funnel shape, slightly concave at the top, appearance to a cavity, and that's a normal looking cavity. It can tell us if there's a big indention at the top of the cavity consistent with an arcuate or a subseptum or a septate or a bicornuate uterus. And more importantly, it'll tell us if there are any endometrial polyps, if there's any retained tissue from a prior miscarriage, if there's scar tissue present or fibroids present. So not only it tells us, yeah, there's something there we need to worry about, it'll tell us what it probably is that we're looking at. And because we're looking at it, we know what it is usually, and therefore we can then use that knowledge to say how do we best normalize the cavity and make it normal. You can also gain information on the uterine cavity from a hysterosalpingogram, and in patients that have had recent hysterosalpingograms, we don't necessarily repeat the hysteroscopy unless it's been a year or we have a suspicion that there may be something hiding inside. A hysterosalpingogram is a fluoroscopic evaluation where it's done in radiology, and the radiologist will put a small catheter in the uterus and inject a liquid into the cavity of the uterus that you can visualize on fluoroscopy. So you can see this fluid fill the cavity as well as going out the tube. So one of the advantages of a hysterosalpingogram is that not only do you get an assessment of the uterine cavity, it also tells you about the fallopian tubes, whether they're open or closed, and if they're blocked, are they dilated, and where they might be blocked. So that's an advantageous test early on in evaluation of a patient where we don't know if the tubes are working and the uterus is normal. If there is an abnormality in the cavity, it's usually reported as a filling defect because the dye does not fill the entire space, and you get a shadowing of an appearance of what's abnormal. And as a result of that, you need to have that corrected, and a hysteroscopy is a way to find out what it is that we're looking at. So one advantage of the hysteroscopy is you get to see what you're looking at. The advantage of a hysterosalpingogram, it tells you about the uterine cavity, but also gives you some information about the fallopian tubes. The limiting factor of the hysterosalpingogram is that if you have an abnormality present in the uterus, it doesn't necessarily tell you what it is. It just tells you there's something funny there. And the third test of uterine cavity integrity is called a Saline Infusion Sonogram, or an SIS. And it's very similar to the hysterosalpingogram in that you're injecting a fluid into the cavity and using, in this case, ultrasound rather than fluoroscopy to look at the shape of the uterus. And it's the same sort of premise where you're injecting some fluid, you're doing an ultrasound to see the fluid distend the cavity, and you're looking for a defect within that distended funnel. Is there something, a filling defect there that's not allowing this fluid to fill the cavity and creating a problem? So pretty good at determining, yes, there's some abnormality there. Based on the appearance on ultrasound and the shape of it, you can sometimes get a sense as it's probably scar tissue or a fibroid or a polyp, but you're not looking at it directly. And in order to see exactly what it is, then the hysteroscopy is the best method. So all three of those are equally good, particularly when they come back normal. And why is normal important? Normal is important because we need to know that there's nothing hiding in the cavity that would prevent an embryo from sticking. What do we do if we find an abnormality? Obviously, we have to correct it. An abnormality in the uterus is not going to affect our ability to get eggs from IVF. It's not going to affect your ability to ovulate. It's not going to affect the ability of the egg to be fertilized by sperm, but it may affect the ability of an embryo to implant. And any submucous fibroid, endometrial polyp, and scar tissue in the cavity while none of those things totally preclude pregnancy from occurring, it makes it more difficult, and in the case of fibroids particularly, can increase the risk of miscarriage and so forth. So they're very important tests. One from a basic fertility assessment, hysterosalpingogram. If we're not interested in the tubes because you've had previous tubal ligation, or we're doing IVF directly as a treatment method, then we don't really care about the tubes unless they're dilated on ultrasound. If there's no history of tubal disease and we're doing IVF, let's say for severe male factor or diminished ovarian reserve, knowing about the tubes is less important, and our preferred method is a hysteroscopy. Hysteroscopy, again, is done in an office setting. We usually ask you to take some Motrin or Advil before you come. In most cases, it's a very simple procedure. A speculum is placed. We wash the vagina with an antiseptic solution and put the telescope into the uterus and see what the cavity looks like. In some cases, where the cervix is very stenotic, then we may have to put some local anesthesia around the cervix to gently dilate it to allow the telescope to enter. But most of the time we can avoid doing that, and you're able to drive home. The only recommendations afterward is just to avoid relations that night, and that's about it. So I hope this has been helpful. All three of these are, one of the three are commonly utilized throughout any fertility assessment, and it's certainly an important part of understanding, is my uterus normal? Is there anything hidden inside the cavity that would prevent me from getting pregnant? So have a good day, stay safe, and we'll see you next week.